Environmental Health Impact Assessment, MQB7034, Environmental Health. Part 8, Health Impact Assessment. Welcome everybody to the session of Environmental Health Impact Assessment. Today we'll delve into the integration of health impact assessment within the Environmental Impact Assessment framework. HIA plays a crucial role in evaluating potential health outcome of projects, ensuring that health considerations are part of decision-making processes. Let's explore the principle, process, and the application of HIA. What is the Health Impact Assessment? Health Impact Assessment, or HIA, is a structured process involving procedure, methods, and tools that help us assess how a project or policy may affect the health of a population. According to the WHO Gothenburg Consensus of 1999, HIA not only evaluates the effect but also examines their distribution within the population, allowing us to understand who might benefit or be at risk of the project development. HIA ensures that health is given due importance in policy and project development. By highlighting health consequences, it helps decision makers make informed choices that prioritize public health well-being. This process encourages holistic approach to development, balancing economic, environmental, and health concerns. The timing of EIA is critical. Ideally, it should be conducted early in the decision-making process to allow its finding to influence outcome meaningfully. Early engagement ensures that the health impact are not just an afterthought, but a central consideration from the start. While HIA often conducted as part of environmental impact assessment process, its applications are broader. HIA can be used independently to evaluate the health implication of non-HIA projects and policies, ensuring proactive health management in various contexts. HIA is inherently diverse. It is grounded in research and evidence linking policy to health determinants. Public involvement is a cornerstone to this process, ensuring that the voice of communities are heard. Collaboration between public health professionals and decision-making is essential to align health goals with broader policy objectives. The EIA process. Now we will discuss about the environmental impact assessment process before we delve into the health impact assessment. The environmental impact assessment process consists of 5 main stages: screening, scoping, assessment, review, and decision making. In the screening process, we determine whether the project requires EIA or not. So, is the project part of the list of the first and second schedule? What type of activity is involved? Where is activity located? What are the potential impact of the project? Scoping identifies the critical issues to be addressed. What type of activity is involved? Where is activity located? Who will be affected by the project? What are the potential impact of the project? Scoping identifies areas that need to be addressed in the EIA. The product of a scoping is the term of reference for the EIA consultant and the project proponent or the project owner. Assessment involves gathering data and engaging stakeholders. So, which stakeholders to engage? What type of impact studies need to be conducted? Emission studies and modeling. social impact assessment, health impact assessment, assessment of forestry, flora and fauna, fishery, coastline and rivers. The assessment will look into current condition and develop model for potential impact. It also includes identifying alternatives to ensure limited impact to the environment. Review will ensure the completeness of the process. The EIA report will be submitted for review by relevant authorities. It is to check for the completeness of the EIA process. The EIA consultant and proponent, or the owner, will present the EIA report in a meeting which consists of all relevant authorities for discussion, comments, and improvement. Finally, decision-making evaluates the findings to decide the project's fate, ensuring it includes an environment management plan if approved. Now, we discuss on the HIA process, or the Health Impact Assessment. Health Impact Assessment process mirrors the EIA stages, but with specific focus on health. It begins with screening to decide if HIA is required, followed by scoping to define the project's boundaries. Profiling involves gathering baseline health data. Assessment analyzes health impact using evidence and models, and leading to recommendations that inform decision making and project planning. In screening, we ask, does the project require HIA? Or proposed project developed under Schedule 1 and Schedule 2 of EIA order shall be looked into possible negative impact on health of the local community. So we ask what type of activities involved, where is activity located, what are the potential impact of the project. We identify the zone of interest, which is usually within 5 kilometer radius of the project site. Identify the stakeholders and plan for engaging them within the zone of interest, usually. Identify sensitive receptor and the relevant exposure pathway within the zone of interest. Sensitive receptor, it can include residential area, villages, schools, hospital, and other relevant receptors. Identify the main public issues and impact to be studied. Define the boundaries of the HIA study, means that what we are going to study and how we are going to study them. This is something like a proposal that we're going to develop, and identify methods for the study. We will look at from site preparation, construction, operation, and abandonment needs for HIA. Profiling establishes the health status of the communities before a project begins. The objective is to provide baseline information on the health status and identify health determinants of the communities prior to the construction and operation of the project. Profiling involves the collection of baseline data through community and household survey and review of existing health records and data. The health data collected includes data on communicable and non-communicable diseases. In addition, relevant health data related to a specific hazard related to the project will also be collected. Here are some examples of household survey information to be collected. It can include description of household member, health status of household members, source of water supply, wastewater disposal, waste disposal, exposure to industrial emission, any outdoor activities that the household are involved in, what are the food source of the household, Is it from market, local, or from self-planting or self-sourcing from the environment or the forest? And also we need to identify how many of the household are exposed to workplace hazard. And finally, look at the main concern of the household on the project, particularly focus on health concern. For the health data, the data includes data on vector-borne diseases, food and waterborne diseases, zoonotic diseases, acute respiratory infection, chronic respiratory diseases, cardiovascular diseases, skin diseases, birth defect, cancer, and data relevant to vulnerable groups. The data usually collected includes data within the zone of interest and also data within the district health office to identify whether there are certain vulnerable group or certain diseases that are present within the community. The assessment of health impact can be accomplished using both qualitative and quantitative assessment method. Qualitative assessment focuses on understanding the non-numerical descriptive aspect of health impacts. This process is particularly useful for capturing live experience of affected communities and addressing complex, multifaceted health issues that cannot be easily quantified. It includes stakeholder engagement, narrative analysis, exposure pathway evaluation, and policy and regulatory review. Stakeholder engagement involves consultation, focus group discussion, and interview with local communities, health professionals, and other stakeholders. It provides an insight into public health concern, perceived risks, and potential health benefit. Narrative analysis analyzes case study, anecdotal evidence, expert opinion to identify potential health impact, useful for exploring issues like mental health, psychosocial stress, and community well-being. Exposure pathway evaluation identifies pathway through which health impact may occur, such as air and water pollution or noise exposure, help assess the vulnerability of specific group, example children or the elderly. Policy and regulatory review includes examining existing health policy and regulation to understand how they might mitigate and exacerbate the identified impact. Quantitative assessment involves numerical evaluation of health impact using data, model, and statistical method. The approach provides measurable evidence-based prediction that support decision-making. It includes data collection, risk assessment framework, modeling, and simulation. Data collection, gathering data from the health survey, epidemiological studies, and environmental monitoring. Examples include air quality indices, hospital admission rates, and prevalence of chronic diseases. Risk assessment framework includes hazard identification, dose response assessment, exposure assessment, and risk characterization. For example, qualifying the relationship between air pollutants level and respiratory illnesses. Modeling and simulation uses mathematical model to predict potential health outcome. Example include dispersion model of air pollutant and their impact. The assessment phase identify hazard, evaluate exposure, and characterize them. It can include respiratory effect on exposure to airborne pollutants, risk of vector-borne and zoonotic diseases, risk of food and waterborne diseases, risk of odor and noise risk, physical injuries, and risk of chronic diseases including cancer risk. By modeling the risk, we predict potential outcome such as respiratory diseases, vector-borne illnesses, and even possible health impact and enabling target intervention. Finally, we look at scenario analysis. where we explore various scenarios, including worst and best case scenario, assess the cumulative impact of multiple exposure over time. The assessment of health impact can be accomplished using both qualitative and quantitative risk assessment method. The robust HIA integrates both qualitative and quantitative method to ensure holistic understanding of health impact. Strength of integration: qualitative insights provide context for interpretation of quantitative data. Quantitative findings lend credible and precision to qualitative assessment. Together, they address uncertainty and capture both tangible and intangible health outcomes. Mitigation and measures focus on reducing and limiting adverse health impact. Risk management integrates scientific findings with engineering, social and economic consideration. This approach ensures that projects achieve their goals while safeguarding community health. To conclude, health and environmental impact are deeply interconnected. Protecting public health requires collaboration across sectors and a commitment for holistic decision making. As awareness grows, so does the demand of experts in HIA, underscoring the importance of sustainable development. Thank you.